Hello viewers, in today's video we will talk about the National Action Plan for Prevention and Control of Snake Bite and Venoming, or NAPSE. This is a document released by the Ministry of Health and Family Welfare Government of India. It aims at halving the deaths and disabilities due to snake bite and venoming by 2030. So let's have a look at it. It's a 200-page document, so I'll just focus on the important parts. You can look at the entire document. Link to it will be present in the description below, and this is in the public domain, so you can also download it yourself. Now this is a very interesting page in the document. India, traditionally known as the land of snake charmers in the west, has deep roots of snakes being revered as symbols of supernatural power and important objects of worship. In Sanskrit, the word Naga is used to refer to the cobra or snakes in general. The Hindu mythology portrays many gods decorated with snakes or cobras around their necks or as ornaments, parading their fearlessness and immortality. In Greek mythology, Asclepius, very relevant to doctors, a mortal man who was believed to be resurrected later as the god of medicine, learned the secret of controlling death when he observed a mortally injured snake being brought back to life with healing herbs administered by another snake. So, here there is a timeline of the development of polyvalent anti snake venom. I believe it was developed in Bombay in Hafkin Institute in 1945. This polyvalent antivenom is effective against the venom of four principal snakes in India. This is another important chart. It shows the burden of disease. Disease in this question is snake bite globally. As you can see, the continent of Asia has 1.2 to 2 million snake bite envenomings annually and reports about 57,000 to 100,000 deaths annually. By far, it is the most. It is followed by Africa, then by Latin America and South America, and Australia does not really have that many deaths, and even North America does not have that many deaths. The world is home to 3,509 species of snakes, out of which 600 species are venomous. In India, 310 snake species are documented. Only 4 out of 310 have been identified as primary contributors to life threatening snake bites. Termed the Big Four, these species encompass the spectacled cobra, scientific name Naja Naja, Bengali name Gokro; Russell's viper, scientific name Daboya russelli, Bengali name Chandrobora; common crate, scientific name Bungarus sedulus, Bengali name Kalkeute; and saw-scaled viper, scientific name Echis carinatus and Bengali name Khude Chandrobora or Forshabora. The exclusive antivenom available in India is formulated to counteract the venom of these aforementioned 4 species of snakes. So, one needs to understand this, that while these 4 species stand out as the most medically significant snakes in India, numerous other snakes also pose substantial threats to human life. In India, around 90% of snake bites are caused by the 4 species mentioned. They are together known as the Big Four. That is the common crate, Indian cobra, Russell's viper, and saw-scaled viper. However, the administration of polyvalent anti-snake venom containing antibodies against cobra, Russell's viper, saw-scaled viper, and common crate is only effective in 80% cases. So, 90% of snake bites are caused by these 4, and even if it is caused by one of these 4, the polyvalent anti-snake venom is effective only 80% of the time. Of course, the polyvalent anti-snake venom will not be effective in other species. Most likely it won't be effective because it has not been developed with venom of other snakes in mind. But even in these 4 snakes, it is effective only 80% of the time. Of the 4, the most number of mortalities are caused by the Russell's viper or Chandrabora. It also produces a very painful bite. As per Wikipedia, 25,000 deaths are reported in India due to snake bite from the Russell's viper, which usually avoids human beings, but when it's provoked beyond a certain point, it does bite. It causes a very painful bite and about 25,000 deaths annually in India. The saw scale viper also produces a painful bite, and it has larger mortality globally because it has a wide range. Now you can see the range here. As you can see, the saw scale viper. This is the saw scale viper. This is its range in India, but it spreads to other parts of the world as well, including Pakistan and Middle East. So, and Russell viper is here. The Indian cobra is known as gokro. This is also responsible for many deaths in India, but the percentage of critical envenomings by the Indian cobra with respect to the number of times it bites is quite less. Common krait is also a very dangerous snake, and it does produce a lot of deaths in India. And but as per figures available, most number of deaths are caused by Chandrabora or Russell's viper. Now another important thing is snakes like the king cobra, which are known as the largest venomous snakes worldwide. They are present in many parts of India, and the polyvalent anti-snake venom that is used to treat snake bite patients is not effective against king cobra bites. So I think that is a very dangerous thing, and one needs to make efforts to develop anti-snake venom that is effective against more species of the snake. I believe there are media reports where synthetic antibodies have been developed, but the only treatment that has been clinically approved is through polyvalent anti-snake venom in India. I feel more rapid progress is required. Let's look at a summary of the current challenges and the recommendations for first aid in snake bite envenoming. So one of the common techniques that we have encountered as first aid is tourniquet. The thing is, we assume that if you tie something proximal to the site of snake bite, the blood will not flow upwards and will not reach the heart. Now this is controversial because the use of tourniquet is associated with significant complications which can result in worsening morbidity and mortality. Morbidity means worsening of the condition of the patient, the disease may become more severe, and mortality, of course, means death. Tourniquets can impede blood flow, which can lead to ischemia, gangrene, and potentially you may need to remove the limb or cut the limb or amputate the limb. Moreover, psychologically, victims with ligatures tend to believe that venom flow has been inhibited. This is the most important point. Victims start believing that venom is no longer flowing. In such instances, there is an additional danger that the confidence in the power of the ligature will lead them to seek medical attention with less urgency. So, this is the problem with tourniquets. So, what should you do? Tourniquets should be avoided as their use may lead to complications. If already applied, remove the tourniquet slowly after ensuring that an IV line, intravenous line, and resuscitation facilities are in place to avoid pronounced clinical deterioration. Do not remove the tourniquets at the field level. So don't remove the tourniquet outside the hospital. Now some people believe in making an incision around the wound. Cutting of the wound and sucking blood may lead to wound infection, increased swelling and or significant bleeding in cases with hemotoxic envenoming like viper bites. Now, wound incisions do not significantly improve outcomes in snake bite victims. They can cause more harm than good. So they should be avoided. Don't try to cut the wound, don't try to suck the venom. That's only for fictional depictions of how to treat snake venom. Now, washing the bite site. This might make sense to somebody who is not aware of this, but washing the bite site requires rubbing of the skin, which can potentially worsen the symptoms, and this can lead to accentuated systemic venom absorption and exacerbate local tissue damage. So rubbing of the skin, again, washing and rubbing the skin, not a good idea. So nobody should touch the wound or wash the wound in the bite mark area. Electrical therapy and cryotherapy sound like promising options, but these techniques may potentially result in deleterious effects. That is, they can make the situation worse. Patient can even go into coma. They may develop incontinence, further complicating management, that is, treatment. So, electrical therapy has no role in snakebite. First aid and cryotherapy may do more harm. Traditional medicines. What does the government of India say about traditional medicines? Sometimes prior ingestion and local application of traditional remedial materials may complicate the clinical picture of a bite case. Conclusive evidence that these interventions can improve outcomes or produce symptomatic relief is lacking at present. So, this is a very politically accurate way of saying that they are not effective. Although traditional medicines can potentially reduce pain and prevent lethality, detailed studies are required to understand their wider application. Thus, it is not recommended to apply these therapies at the field level. Now, what is effective? Pressure immobilization is effective. Their clinical efficacy and potential to worsen soft tissue injury in cases of local their clinical efficacy and potential to worsen soft tissue injury in cases of local cytotoxic envenoming have been inadequately assessed. Inappropriate usage may affect victims' arterial and venous flow. These techniques require special equipment and intensive training, which is poorly retained. So, the technique is good, but if you don't know it, it can do more harm than good. So, what is the recommendation? This method has been identified as an effective first aid measure in some regions. So, pressure immobilization is an effective first aid measure. How do you apply it? Applying a pressure immobilization bandage with a pressure between 40 and 70 millimeters of mercury in the upper extremity and between 55 and 70 millimeters of mercury in the lower extremity around the entire length of the bitten extremity can be a reasonable way to slow the spread of venom by slowing lymph flow. Larger studies in snakebite victims are required to assess their application in patients with local cytotoxic envenoming. In resource poor settings, immobilization of the victim and particularly immobilization of the bitten limb using a splint is recommended. Lymphatic flow is the thing, so if you can use pharmacological agents to inhibit the lymphatic flow, would that be effective? The trials are still on and the evidence is insufficient. So, clinical evaluation is insufficient for field trials, although there is some evidence that lymphatic flow inhibitors can slow venom transit from lymphatics to circulation. Clinical studies are needed before recommendation for use in human beings, that is, in field conditions. Now, another effective technique is reassurance. Snake bites are dramatic events and can be associated with significant anxiety. Even reading about it, talking about it is causing me anxiety. So, imagine somebody who has actually encountered a situation where they've been bitten by a snake. So, what should we do? Victims must be reassured that most snake bites, approximately 70% in India, are by non venomous snakes. Okay? Even in instances where a victim is bitten by a venomous snake, venom may not have been injected during the bite, that is, a dry bite. Victims must also be reassured that snake bite envenoming is treatable. It is not a lethal condition if treated. So, there may be non specific symptoms also, such as anxiety, which triggers sympathetic activity. These can be mistaken for early envenoming and include palpitations, sweating, tremulousness, tachycardia, tachypnea. These terms may not make sense to people who are not doctors. So, palpitation means you're aware of your heartbeat. Tachycardia means increased heart rate. Tachypnea means increased breathing. Elevated blood pressure is fairly self-explanatory. Cold extremities and paresthesia, which means tingling sensation in the skin. These patients may also have dilated pupils due to anxiety, not due to any snake venom, which are also observed in snake bites with neurotoxic envenoming. So, even neurotoxic snake bite can also cause dilation of pupil, and if a person is alarmed, anxious, their pupils may also dilate. So, non-specific symptoms should be differentiated from the symptoms and signs of the envenoming, which require careful observation. So, you have to admit the patient and carefully observe the patient. Now, there are some challenges associated with identification of the snake species by the victims. Also, this also I felt is interesting. So we will talk about this as well. Now, identifying snakes based on descriptions by victims or recognizing them from pictures can be unreliable since many instances of bites occur at night, in the dark, or in the undergrowth, which obscures characteristic markings on the biting species of snake. Though direct identification of the biting snake by an expert herpetologist, that is a reptile expert, somebody who studies reptiles is called a herpetologist. Though direct identification of the biting snake by an expert herpetologist is possible in instances where patients or their relatives bring captured or killed snakes to the hospital, this is a very common practice, that if a snake bites a person, the relatives or the person himself kills the snake and brings the dead snake to the hospital. Of course, things can become tricky if the snake is not dead. So, just to repeat, though direct identification of the biting snake by an expert herpetologist is possible in instances where patients or their relatives bring captured or killed snakes to the hospital, errors in the identification can still occur. How evolutionary mimicry of venomous by non venomous species can be an important challenge to accurate identification by non experts. So, what happens is non venomous snakes also pretend to be venomous to for their own protection, to pretend that they are dangerous, so they should not be messed with. So, even non venomous snakes start mimicking the appearance of venomous snakes. This is evolution at play. So, species specific venom detection kits are not currently available for clinical use in India, so it's very difficult to understand which snake is dangerous and whether the snake in question is dangerous or not. So, species specific venom detection kits should be available. Now, what are the recommendations? As per the government of India, the recommendations are withholding emergency care till the likely species is identified is unnecessary and can cause harm. So, don't wait to identify the snake species before starting emergency care. Provide emergency care on an emergency basis. Don't wait to identify the snake species. The decision to treat snakebite envenoming with antivenom should be based on the presence or absence of symptoms and signs of envenoming and not on whether the biting snake is identified as venomous species or not. Okay? Don't try to identify whether the snake was venomous or not. Try to identify whether the symptoms and signs present in the patient are that of snake envenoming or not. If the symptom signs are present, start treatment. Don't worry about identifying the snake and labeling it as venomous or non venomous. In most parts of peninsular India, consider identifying the likely biting species once emergency care, including antivenom, has been administered based on standard guidelines and the patient is stable. So, only after the patient is stable, you try to find out which snake caused the bite. This will help anticipate and specifically look for clinical effects which can be specific for some species. So, once you've stabilized the patient, if you identify which snake caused it, you can anticipate events. You can understand what is likely to happen in the future, how the patient's recovery will progress, and how it can worsen. Identifying biting snake species is important in regions like northeastern India where species other than the big four are more prevalent. This you remember from the map we showed. Venoms of many of these species cannot be neutralized by Indian antivenom. So, this is the key thing. The Indian antivenom is only effective against 4 species of snakes. They are not encountered that often in northeastern part of India. So, it's something that needs to be looked into. The administration of Indian antivenom in such victims will be ineffective and will also expose them to potentially life threatening adverse effects. If the snake has been brought along with the patient, contact a herpetologist or a poison information center to assist with snake identification. Posters of venomous snakes of local area need to be displayed. Additionally, compare patients' clinical features with standard species specific envenoming syndromes available in Indian standard guidelines to infer likely biting species. So, this is how you treat first aid and then you go for treatment with anti snake venom. However, despite the best efforts, if a patient succumbs to snake bite, what is then done? So, let's look at that. Well, this is from the Government of India document titled National Action Plan for Prevention and Control of Snakebite and Venoming. On NAPSE, here we see the provision of compensation, and it is different in different states in India. In Bihar, a person, if they die due to snake bite in the state of Bihar, the state government will grant ex gratia rupees 4 lakhs to the next of kin of the deceased. Okay, in Uttar Pradesh, after the confirmation of a snake bite death, the district magistrate will have to ensure that rupees 4 lakh compensation is provided to the family of the deceased within 7 days of the incident. In West Bengal, rupees 20,000 only in each death case to the next of kin of the indigent person as a result of sunstroke or snake bite, on being satisfied about the genuineness of the case of death. So I believe in West Bengal the person has to be indigent also, which means poor, and the compensation they get is 20,000 rupees. In Kerala, if the loss of human life is on account of snake bite, the compensation will be limited to 1 lakh rupees if the accident occurs outside forest areas. So maybe in forest areas they'll probably not get the compensation. I'm not very clear about that. So instead of trying to understand it, let's just look at the figures. In Bihar, the compensation figure is 4 lakh rupees. In Uttar Pradesh, again 4 lakh rupees. In West Bengal, 20,000. In Kerala, 1 lakh. In Karnataka, 2 lakh. In Madhya Pradesh, 50,000 to 4 lakhs. Yes, that's a big range. I don't understand that at all. Maybe we can make a new video talking about how these compensation applies. Chhattisgarh, it's about 1.5 lakhs. Punjab, 2 lakhs. Odisha, 4 lakhs. Okay, so maybe we can make a video on the different compensation in different states of India due to provided to snake bite envenoming victims. So there you have it. India, the treatment for snake bites in India is largely based on the administration of polyvalent anti-snake venom, which is effective against 4 major species of snakes. These snakes are responsible for 90% of critical morbidity and mortality as a result of snake bites. These 4 species, just to repeat, are Naja Naja or Indian cobra, known as Gokhro in Bengali; Russell's viper or Daboya russeli, known as Chandrabora in Bengali; common krait or Bungarus ceruleus, which is known as Kalkeute in Bengali; and saw-scale viper, Ichthys carinatus, which is known as Khude Chandrabora or Furshabora in Bengali. So these 4 snakes have anti-snake venom against them. However, the anti-snake venom is effective only in 80% cases. In all the other snakes, I believe there are 310, is that the number? 23 snake species in India are recognized for their medical importance because they are capable of inducing fatalities in cases of snake bite envenoming. So there are 23 species, and this is the list of the medically important snakes in India: Russell's viper, hump-nosed pit viper, mountain pit viper, banded krait, crater black krait, lesser black krait, red-necked keelback, northern large-scaled pit viper, spectacled cobra, common krait, hook-nosed sea snake, Himalayan pit viper, large-scaled pit viper, Malabar pit viper, saw-scaled viper, short sea snake, signed krait, Salazar pit viper, Andaman's cobra, annulated sea snake, Central Asian cobra, Soshurex saw-scaled viper, and king cobra. 23 medically important snakes in India. Only 4 are termed as the big 4: Russell's viper, saw-scaled viper, Indian cobra, and common krait. Polyvalent anti-snake venom acts only against 4 of the 23 medically significant snakes in India, so you can see the problem right away. I hope it is solved very quickly because I am scared of snake bites. Thank you for watching this video. Take care. Bye bye. And please don't forget to be awesome.